Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets. Hey, welcome back to Between the Sheets. I have an exciting guest on here for you today to talk about some sexual wellness tools. We have Soum. He is the CEO and co-founder at MV Health, previously known as Mystery Vibe. That's where the MV comes from. So very excited to have you here and talk about your products.
Thanks so much for having me.
Yeah, absolutely. So how did MV Health kind of come to be, and how did you kind of get into this area of sexual health?
So our background is biomedical engineering. Our first work was in ophthalmology, building cameras for eyes, so to recognize eyes. The application was in defense, but the work was pretty much the same, where doctors would tell us what to build and we'd build it. So this is back in 2004,
Okay.
21 years ago. So we sold that company in 2008, and then since then we looked at various healthcare areas that we could delve into, again, build useful solutions. And over time, between then and 2014, when we started, the biggest topics that kept coming up was sexual health, menopause issues, post-childbirth issues, pelvic floor issues, erectile dysfunction, prostate pain, cancer, And what was interesting is, even though all of these topics kept coming up in conversation, there wasn't much discussion about it in public, like in media or externally, and not many doctors talked about it. And this is obviously 10 plus years ago. So we then reached out to NHS. So we're based in UK, the National Health Service. They have a clinical entrepreneurship program where you can go and meet doctors in very specific areas to find out more about what it is, what the solutions are, what is the gap. So through them, we met the head of urology at King's College, who had been researching for 30 years on vibration and using vibration for various urogyne issues. So over time, we started building our R&D center, building various types of vibration motors, malleable materials, and eventually in 2019, so starting from 2014, eventually 2019, we got our first product and we got our FDA registration. So then we started doing clinical trials, and now we have 6 products. We're 11 years old now, so we have 6 products. We have 12 journal publications, ranging from pelvic pain to prostate pain, to erectile dysfunction, dryness, arousal disorder, anorgasmia, a whole host of things. And recently, just at the end of 2024, we crossed 200,000 users in US with a 95% efficacy, and that was the very big target for us. Is how do we get to the point that our devices are adaptable enough, personalizable enough, that it can deliver the targeted vibrations exactly where it's needed, like on the pelvic floor at the right point, on the prostate, wherever, and that the user themselves can tailor it without needing it to be customized, without needing to go to a specialist if they don't have access to one. So and for us, getting to that 95% with a big enough data set was a big target and milestone.
Yeah, that's amazing. And what I love is that you do have the science that backs this, and they are approved, I believe, to be able to use the FSA and HSA accounts.
Yes. Yes.
Which is amazing.
Yes, that's a really important point. And accessibility, I feel, is even more important than innovation in healthcare, because often people like us, we love engineering and we would spend years building something really cool. But then if it's not available easily, and 2, if it's price prohibitive, then no matter how good the innovation is, it's not very valuable to the world of healthcare. So the FSHSA piece, I think, took 2 years, but eventually all of our core devices now are in the SIGIS list. They have their codes. People can use their cards straight on our website. They don't need to do anything. It's a completely simple hassle-free experience. They don't need any prescriptions. So it's a very simple way and a discreet way of
Yeah.
getting access to devices. And the next piece that we are working on with CMS, and especially with Advomed's help, is creating reimbursement codes
Mm.
to have full coverage for all kinds of urogyne issues, whether it's pelvic pain,
Yeah.
vaginal dryness, arousal disorder, etc. Where none of the codes currently exist for devices, so DME codes,
Yeah.
which we've been working for 2 years now, and do hope that within a year we should be able to create some codes, because the cost saving is 90% compared to the existing CPT codes. So
Okay.
there's a significant cost saving. And also going back to the
Yeah.
point of access, so even pelvic floor therapy, there are 40 million women in the US with pelvic floor issues and less than
Mm-hmm.
10,000 PTs. So there's a
Yeah.
huge gap between the clinicians and the patients. And even when they do get to see a clinician for the next appointment, they might have to wait a few months. Whereas in practice, they ideally need to see them 3 times a week for 12 weeks for a proper therapy full set. Where devices become very useful is if they have one session, get trained, go home with the device, use the device 3 times a week, whenever is convenient for them. And that
Right.
makes it much more accessible, especially for a new mom looking after a baby.
Mm-hmm.
Taking, say, 2 hours out of their day to go for therapy is really hard. So all of these factors affect access to healthcare,
Yeah.
and money is just one of them. But there are
Mm-hmm.
so many various factors, and then the device-based solution addresses access at the top level, and then obviously needs to the patient outcome needs to be as good, if not better, compared to
Right.
therapy.
That's amazing. I love that this is out there. Just before we get into the individual products and kind of what they're good for, what are kind of some highlights where your product is truly for improving wellness and sexual satisfaction versus just climaxing, like you might go get a random vibrator from an online store or Walgreens. I mean, our Walgreens sell them now. So, what is the kind of overall benefit of your products?
So I would say the two main pieces are the vibration frequency and the malleability. So
Okay.
the core of our research is very much the vibration is what frequency. So it ranges from 50 to 100 hertz, and
Mm-hmm.
that frequency has been clinically proven with at least 20 to 30 years of research, which is long
Okay.
predates our work. So there is
Yeah.
well-established research in the use of vibration,
Mm-hmm.
both in sexual health and general pain relief, like for example, a back pain,
Hmm.
neck pain, all of that can be addressed with vibration. So vibration is a very well-established area.
Yeah.
And actually, vibration came in 100 years ago in sexual health,
Hmm.
and the application of vibration pleasure came in much later. So the
Yeah.
medical applications came much, much earlier, and then over time, pleasure applications came in. So there's a huge breadth of evidence in clinical literature for the use of
Mm-hmm.
vibration in urogyne health. So that piece is really important, the custom
Mm-hmm.
design motors, the right frequencies, etc. And the
Mm-hmm.
second piece, which is just as important, is delivering that vibration at the right point. And
Mm-hmm.
that's where the malleability, the special materials that we create is so important, whether it's bending to reach the pelvic floor, bending to reach the prostate,
Mm-hmm.
or wrapping around the penis exactly. So it's tight enough, but not too tight,
Yeah.
leaving the gap for ejaculation. So it's all of these various personalization that the patient can do as they use the device in order
Mm-hmm.
to be exact, very precise in the vibration and the delivery. So
Yeah.
that's really where our focus is.
That's great. I love that. So, talk to me through some of your devices. I know you said you have 6 of them. So, let's
So
start with
yes,
one and then just kind of work through
yeah.
and what they're for and their benefits.
So the simple way of looking at it is all of them are fundamentally the same, just in different shapes.
Okay.
So the underlying electronics is the same. A lot of the motors are the same. The main difference is how they are structured. So the first device is Crescendo, which mimics two fingers. So the user can bend it exactly how they need, insert it, reach the pelvic floor, vibrate. And
Okay.
because it's long enough, they can use it for stimulating different areas. So maybe they need to stimulate the vulva or the labia for dryness, for arousal, for an orgasmia. So these are all the various studies we have with it.
Sure.
So then the second one is actually a mini version of Crescendo, which is called Poco, for use where you would want a more smaller, more compact device.
Okay.
That we've done a study on vulvodynia, where you need a small device just for the vulva. Then the third device on women's health side is a labia vibrator. It's called Legato, and that was designed with menopause specialists for
Mm,
women who can't insert anything due to atrophy, due to dryness, due to
okay.
pain, and they need vibration stimulation, but only on the outside. And when we were told this as a criteria, we obviously researched, and there isn't any device yet out there which just does an adaptable labia
Mm-hmm.
stimulator. So that's what Legato. So that's why we built Legato. Then on
Okay.
the male sexual health side, the erectile dysfunction is designed to simulate the penis glands, which is the head.
Mm-hmm.
It's stretchy, so it can stretch to fit 95% of penis dimensions, and then constrict to vibrate exactly where needed. And then
Okay.
you slide it down, hold it at the base to constrain the blood flow, to stop the blood from going back once you get erect. And then so it has two versions. One is
Mm-hmm.
the just the version around the penis head,
Okay.
which is 10 to mini, and then 10 to 2 is the one which has dual stimulation, penis and perineum. So that
Okay.
helps with ejaculation as well as erection. And then our sixth device is single finger and index finger device, which mimics what urologists do with their fingers by going inside the rectum, reaching the prostate, very flexible, vibrating on the prostate, which is very useful for prostate pain, enlarged prostate, and generally improving prostate health by releasing the secretions through vibration. So those are the six products we currently have. Then
Yeah.
we are currently working on a belt for period pain.
Okay.
Again, purely vibration, very subtle, can be worn under the clothes, no noise.
Mm-hmm.
Bra for mastitis, which is breast pain during breastfeeding.
Mm-hmm.
Again, a very, very subtle device which vibrates to help with pain relief.
Okay.
Then we're working on a penile constriction device, which helps with, which is a passive device, but it helps very subtle, very thin, helps with containing the blood flow in order
Okay.
to hold the erection. And then
Mm-hmm.
we're working on another one, which is a post-penile surgery compression sock,
Okay.
um, which is a single hand use. That's more a surgical or post-surgery device. So those are
It,
the four we're currently working on.
wow, that's really neat. You have a very good array of things. So, talk to me about the crescendo, and then you said the one that's smaller is it Poco? Is that correct?
Correct, correct.
Okay. So, what are some of the symptoms that women would particularly use those products for?
So the four studies we have with them, one is pelvic pain, which
Okay.
is genital pelvic pain penetration disorder, GPPD.
Mm-hmm.
The second is arousal disorder. The third
Okay.
is vaginal dryness, and the fourth
Okay.
is anorgasmia. So those are the
Okay.
four we currently have studies on. There's a fifth study that's currently running, which is on vulvodynia, and those are the five areas that we have looked into.
Okay.
There could be other applications of it, like with, let's say, using the device on the perineum for pelvic floor therapy, for stimulation, but we haven't done those studies yet. So there are other things to do, but the four areas which are published:
Mm-hmm.
pelvic pain, arousal disorder, vaginal dryness, and orgasmia.
Okay. And if you're having pelvic pain, do you want to position the device at the specific point of pain? Do you move it around? What's the benefit?
So we do have a instruction guide, a very nice
Okay.
visual guide written by pelvic floor therapists, that we obviously have it on our website for people to download, but also we put it in OBGYN clinics, PT therapist centers, so that the patient can take it home. And so
Mm-hmm.
the reason I say that is because it will depend on the patient and how much pain they feel. So
Sure.
sometimes they'll bend it, insert it, feel the pain. Initially, they're recommended to use it just without the vibration to feel it.
Okay.
Then, as they feel more comfortable, to turn on the vibration, because that helps a lot. But
Mm.
initially, it might be too painful for somebody
Sure.
who's in pain.
Okay.
And then, in some cases, just hold it, and in some
Mm-hmm.
cases, rub it. So
Okay.
again, like, it kind of depends on the patient, if they're doing it all by themselves, if they haven't
Mm-hmm.
had one session with a PT, in
Yeah.
terms of the onboarding, which many people can't get to. So,
Right.
if the instruction explains everything on all the things they need to try to make sure that they're doing it comfortably, with
Okay.
the least pain.
Yeah, that's fantastic. And in regards to the anorgasmia, which for listeners who don't know, that's inability to get an orgasm for women, which is more common than it should be. So are they stimulating more internally or externally for the vaginal dryness and the anorgasmia?
So, one of the good things about crescendo is it has two vibration segments, one on the tip and one
Mhm.
at the base. So
Okay.
for anorgasmia and vaginal dryness,
Mhm.
the patients in the trial, they tried both. So they could try either uh, internal stimulation or clitoral stimulation or
Mhm.
dual. So the way crescendo can be bent is the top half can be on the clitoris
Mhm.
stimulating it, and the bottom half can be on the inside the vagina stimulating it.
Okay.
And again, it can be bent to be very precise where that person feels the most arousal. So they
Okay.
can bend around and really get it to be as stimulating as they can,
Mhm.
which makes it much more effective.
Okay. And are there different levels of the vibration that they can go through?
Yeah, so there are 16 levels,
Wow.
and they can
Okay.
set it. And the reason for that is like, when we were talking about the pain in pelvic
Mhm.
pain and pelvic floor therapy, you might want something very low, like nothing, or like little,
Mhm.
little, little. So that's why we have those very, very low ones where you need a very little bit. Maybe you want to increase a bit. So,
Mhm.
you might only stay from 1 to 5. And then, you might have the other issue where there is less sensitivity and you need a lot of vibration. Then you would go up to 16. So, you're staying with that whole philosophy that the user should be able to personalize however they want, what
Yeah.
vibration they want, what shape they want, what
Mhm.
intensity they want, all of it. And
Mhm.
actually, there's an extra layer. If a lot of people don't use it because it's a bit more complicated, is they can
Mhm.
connect to our app, and it's all free. There's no login, there's no data collection, nothing.
Mhm.
It's literally a controller, so they can
Okay.
set individual vibration
Oh.
motors with a pattern, or they can create their own in order to have exactly. And typically, it's used by PTs or
Mhm.
who know how the vibration works. So that's why less patients use it themselves, but anyone can download it, anyone can set it. So
Okay.
that's a whole other level of personalization that people can do.
That's awesome. And have you seen so like we mentioned that if you go to pelvic floor physical therapy, you're probably going 3 times a week for about 12 weeks, give or take. Are you finding that it's about 12 weeks for women to have success with your tools?
Yes,
Okay.
exactly. And also the studies we do, we try to follow the general protocol
Mhm.
so that it's a like for like comparison. And
Mhm.
then the GPVD study, for example, was 3 times a week for 12 weeks, and the pain improvement was 5x. So they started
Mhm.
at zero point 0.4, which is very high pain, and then they finished at 2.3, which is very good and very low pain. And that is similar to what they would get if they went for therapy as well. So
Okay.
we would definitely recommend that the protocol stays the same,
Yeah.
whether they go to a therapist or they use a device, and then they should get the same or better output.
Okay. And then long term, once they're done with those initial 12 weeks, is there like a maintenance that they should continue using it once a week? Do they keep using it 3 times a week to prevent the pain from coming
So
back?
from a trial perspective, we haven't
Mhm.
looked at that, the long-term
Okay.
applications. And also from a therapy perspective, typically
Mhm.
once the therapy is done and you're pain-free, it's unlikely you'll go back
Mhm.
unless you have something else. So,
Mhm.
again, mimicking what happens in practice with the device,
Yeah.
we would, we would say use it typically 10, 20 minutes per
Mhm.
session, 3 times, as long as it takes for you to feel that, you have overcome your pain.
Yeah.
But after that, it's it's more general. It's very good to have blood circulation in
Mhm.
the genitals, whether it's in the pelvic floor, vaginal wall, labia, clitoris, etc. And having that regularly means you have a very healthy urogyne system.
Okay.
Equally, having orgasms regularly has a whole host of benefits,
Mhm.
including better sleep, better skin, better immunity, better hormones.
Yeah.
But that comes, I mean, that's just a fact, which
Right.
is separate, and there are so many benefits to vibration, blood flow,
Mhm.
orgasms that we would recommend people use it anyway. But from a
Yeah.
medical trial perspective, we haven't really done any trials in terms of asking a host of patients to use it for
Sure.
say a year or 2 years and see,
Yeah.
because it's more anecdotal evidence that if you have good blood flow, if you have regular
Mhm.
orgasms, these are the benefits that are already
Yeah.
clinically proven.
Yeah.
And how you have them, whether it's through fingers, through intercourse, through devices, it's probably the same.
Yeah. Okay. That's great. Yeah, I think, especially for like pelvic floor physical therapy, a lot of times when my patients are done going to the actual therapist and they quote unquote graduate, they still have kind of some homework exercises to
Mhm.
continue
Yeah,
to do for themselves. So that's kind of where I was coming from, assuming that, there might just be a little bit of regular use of it just
yeah,
to keep things where you want them.
yeah, yeah, exactly.
Yeah.
Yeah.
Okay. That's great. All right, so let's talk about the legato. What are the ladies? So that one's flat. There's no
Yes.
insertion part. That's
Mhm.
going to go around the vulva area. So what are the ladies using that for?
And also, just like with other devices, it's very malleable. So
Hmm.
it's like this hand, it adapts to sit exactly on the labia, to
Okay.
bend and take the shape so that the vibration, which is across the entire body,
Hmm.
can stimulate every part
Okay.
precisely, which is what was missing when we originally were asked by menopause specialists to look into that. So, and
Hmm.
the way that came about is our tenuto device, which is a ring
Hmm.
which goes on the penis, but a lot of the partners of the men who bought it were
Hmm.
using the front of it on the labia for
Okay.
arousal. And that's how we found out much later through some direct user feedback, but mostly through clinicians, that a lot of their patients were using it. And they asked us, can you make something dedicated for labia stimulation?
Yeah.
So yeah, it's really a very simple device in the sense that it has a big opening, it has
Hmm.
vibration all around, it can be adapted, and you can hold it and keep it in place during intercourse so that the
Okay.
vibration is there the whole time, and you get a lot of blood flow and arousal from the
Hmm.
vibration. And of course, on top of that, add lube. Together, lube and vibration would definitely help with lubrication and arousal.
Yeah. Oh, that's great. So that one's not quite so much for pelvic pain as it is postmenopausal changes and difficulty with lubrication and arousal, whereas
Yes,
other ones we talked about have more that they can do.
correct. And this one
Okay.
is very specifically designed for people who can't insert anything. So they will
Okay.
definitely get more stimulation with
Yeah.
a device like Crescendo, which can be inserted, can be used outside.
Hmm.
But for a significant number of women who either they find it uncomfortable or painful,
Hmm.
or simply don't want to insert
Yeah.
anything, for that population of
Hmm.
users, the legato is perfect.
Yeah, and I'm sure even, even if they are able to insert something, if they do have difficulty with that arousal and lubrication, like you said, they can wear it while having intercourse. So
Yes,
that could even benefit them, with it
yes,
when they're outside of their activity, their strengthening time or their PT type time and they're having their intimate time. That's really beneficial. I love that.
yeah, yeah, very much.
Yeah, that's fantastic. All right. And then so then we're getting over to the Tenuto. So you guys sent me one of these and I think it's great. I have taken it to work with me so I can show it to some of my guys. So who are my guys that are going to benefit the most from Tenuto?
So we've done quite a few studies with it. So psychogenic ED,
Mhm.
which is the biggest percentage,
Mhm.
there was a 2x improvement in erectile scores within 5 weeks. So it was quite
Oh.
quick. In fact, it could be immediate in the sense that they, especially with psychogenic, physiologically they're perfectly fine.
Mhm.
So stimulating the glands, getting aroused, getting a lot of blood flow, putting it at the base, continuing the vibration, vibrating the perineum. And also it's really useful during intercourse because the vibration stays in the front and then it stimulates the labia. So in a way, tenuto can be useful for intercourse for everybody. Yeah,
Mm-hmm.
because most women will need external stimulation to orgasm and wouldn't orgasm purely from penetration. So in that
Mm-hmm.
case, purely from that perspective, it's a very useful device for everyone having
Yeah.
intercourse. Then separate from that, it's a very useful device generally for erection, whether it's psychogenic, which we have a study on. It could also be a post cancer, where ED can be quite common, colorectal cancer, prostate cancer, etc. So we have studies on that. It could be spinal injury patients. So
Mm.
post that, so we have a study on that. So in overall, tenuto is really good for any type of help with erection,
Mm-hmm.
um, either getting erect and staying erect. So both, which is very important because the big piece of tenuto's research on how to help men, like post radical prostatectomy,
Mm-hmm.
get erect again. So and that piece is quite hard.
Mm-hmm.
It works really well if the rehabilitation happens soon after the
Okay.
surgery, rather than if you leave it for a year, it gets harder. So one of our long-term goals is to, again, going back to creating CMS codes,
Mm-hmm.
to have the full reimbursement, to include devices straight in the
Yeah.
kit of post
Sure.
recovery. Then we can solve it at source, just like including a pelvic pain device for a mom
Mm-hmm.
straight out of a
Yeah.
hospital. So we can solve problems at source before they become chronic, or before they
Mm.
become hard to solve, like ED after cancer.
Yeah.
So tenuto, I would say, is a generalist device which works
Mm-hmm.
across all erection issues.
Yeah. No, I love that. And I have a lot of prostate cancer guys, and that's who I kind of had in my mind that I was going to be
Mhm.
talking to about it for sure. But I love that idea of getting it for them even before they have their surgery so they're ready to go and start their rehab as soon as they're allowed to, because penile rehab is so important, and not just for the guys that go through surgery, but for the guys that do the hormone therapy as well, and we take away their testosterone for a long time, they're not getting erections. So the penis is one of those things that if you don't use it, you lose it. You might
Yep.
lose some length, you might lose some girth. And so the
Mhm.
more that we can help them, I think for some of my guys, they know that the erections will come back eventually. But when they do, and they're shorter and in length, and they're not as firm or they're not as thick in girth, that's really upsetting to them. So I can see
Yep.
how beneficial this would be to get it early on and get that rehab done sooner.
Yep. It's so key, which is why I feel like, having spent 11 years on innovation, the key in the next 11 years is access to healthcare,
Yeah.
reimbursement codes, getting it into the hospitals. Because the biggest challenge in sexual health is a majority of people suffer in silence and don't go to a clinician.
Yeah.
They could be struggling with dryness for years, they could be struggling with
Hmm.
erection for years. And these are the people you can help at source, like a mom with pain or someone who's just recovering from cancer. Because
Yeah.
if you send them back home with no help, it's very unlikely they'll come back to ask for help.
Right. Yeah. Absolutely. Absolutely. And I know that the Tenuto, because it does have the part that goes to the perineum, also comes with a remote. So you don't have to try and reach in there and change the level of your
Yeah, so the
vibration or
remote
something.
works across the board. So it's only one remote, and you just connect,
Okay.
and you can control every device. It's just like the app works with everything.
Okay.
And the app is a free remote anyway, because the app has
Okay.
exactly the same features. So some people prefer using the app, which is free, doesn't cost anything, and some people buy the remote. It's only $30. So
Okay.
whichever option, but it's across.
Yeah.
It's one remote, one app for all devices.
That's fantastic. Now you were explaining, so with the Tenuto, or, and I don't remember the name off the top of my head, the one that doesn't have the perineal part is called what?
Mini, Tenuto Mini.
Tenuto Mini. So for those, you said you actually start with it around the glands to get the erection and then
Correct.
you slide it to the base?
Correct. Yes. Yeah.
Okay.
So
Okay.
the
Interesting.
maximum stimulation from the three motors, 360, on the glands helps get erect.
Okay.
Stimulating the glands with a lot of vibration gets erect.
Yeah.
And then the base is more to constrict the blood and
Sure.
contain it, because the base the stimulation of the base doesn't do that much,
Right.
whereas
Okay.
stimulation of the glans does a lot of arousal.
Interesting. Yeah, I have a lot of patients that, especially as they get older, and I always describe it as everything as we get older gets saggy and leaky, and so do the valves inside of the penis. And so they get what, for people who don't know, that's called venous leak. And so you get a really nice erection, but then during the erection, your valve is leaky, and that blood starts to flow out of the penis, and you lose your erection. Now, you can also lose your erection for psychological issues, changing positions took too long, things like that. But for the guys that have this venous leak, that constriction is really helpful for preventing the leak.
Correct. Exactly. And the way we've designed both 2 and 2 mini is it constricts the blood but then has a gap in the bottom, because one of the biggest feedback we got when we started research was a circular ring constricts the ejaculation, and that's quite painful.
Yeah.
And also it makes it harder for if used in fertility
Mm.
or general ejaculations. One of the big engineering challenges for us is how do we maintain that gap, have that flexibility, and still constrict the blood
Yeah.
flow enough, but not too much.
Yeah. No, that's fantastic. It's really amazing, the entire thought process and just how detail oriented you have been, and your team has been in developing these products so specifically. It's amazing.
Yeah, the truth is it's trial and error for many years. So and the reason why it's 10 to 2 is because it probably took us 5 years to make 10 to 1, which
Yeah.
was good, but probably worked for, let's say, 70% of the people. And
Okay.
then we took a lot of feedback, and then we started from scratch again, so 10 to
Mm-hmm.
2, and then now we got to 95%, but we haven't achieved that with 10 to mini, which is 1. So
Okay.
we are now, and have been for a year, building again from scratch 10 to mini 2, which by the time it's ready, maybe later this year, we are
Yeah.
confident that we'll hit that 95% mark.
That's amazing. That's really, really great. And so then the final one is the Molto, and that is more for prostate stimulation.
Yeah.
Okay.
So it literally, again, we get told by doctors what to do. So urologists use a single index finger, insert
Hmm.
into the rectum, press the prostate, and they said, can you make a finger exactly like this?
Yeah.
This dimension, butt has to be very flexible because you don't want
Hmm.
anything hard, it will hurt. So it needs to be like a snake, the
Hmm.
user can easily hold a big bulbous end so it doesn't get sucked in, all these
Hmm.
criteria. And then, but the key was the user easily can insert it, comfortably goes, hugs the rectum, reaches the prostate,
Hmm.
vibrate as little or as much as you want, and very discreet, really easy to use at home. Because again, the big challenge, especially with prostate exams or prostate care, is a lot of men don't go to the doctor because they're ashamed or they're scared, or they
Yep.
think it's awkward, and
Yep.
often it's quite late when they discover cancer. 1 in 6 men
Hmm.
have prostate cancer, so
Yep.
often it's left quite late. So the big
Mhm.
piece here is how can we make it very discreet. Even they might not even tell anyone about it. They might just buy it, keep
Yeah.
it, hidden away, which is fine as long as they use it regularly. You improve their prostate health simply by vibration,
Mhm.
and and maybe it's pain relief in the beginning, but going back to the original discussion about what happens after, maybe somebody buys it because they have pain, and then
Mhm.
they're okay with pain after a few months, but they would be highly recommended to use it at least once a week going forward so that they're keeping their prostate healthy.
Yeah. Yeah. There's a great study that comes out that shows that the ejaculation helps prevent prostate cancer. So, men who ejaculated 21 times in a month had a 20% reduction in prostate cancer versus men who had only ejaculated 7 times a month. And so,
Yeah.
while I know these are not just for pleasure, the prostate is a fantastic place on
Yeah.
the male body to stimulate an orgasm.
Mhm. Yeah. So actually, one of the studies we're currently running is on ejaculation dysfunction,
Mm.
where either delayed ejaculation or very hard ejaculation, where we're using prostate stimulation to see if that helps with ejaculation.
Okay. So,
So we couldn't find any
concurrently,
studies yet on that.
okay. And that would be, you would be using it concurrently with intercourse.
No. Just as a
Okay.
standalone thing, just to
Okay.
understand whether a device vibrating on the prostate
Yeah.
can help improve ejaculation,
Okay.
speed it up, where
Yeah.
it's very delayed. Yeah, so that's the study we're currently running.
Okay. No, that's fantastic because we really don't have a whole lot out there for delayed ejaculation. There's a
Yeah,
couple of medicines that work okay for some guys, but that's about it. Otherwise, it's like, oh, sorry guys, like I don't know what else to tell you. So this is
yeah,
fantastic.
yeah, exactly. So we searched really deeply and we couldn't find a single paper yet on stimulating the prostate for a delayed
Yeah.
ejaculation. So we're running the study. So hopefully we'll get good results, and then that will be a new area that we can
Yeah.
delve deeper into.
Yeah, that's fantastic. Gosh, I just love all of this technology and innovation that can come and help sexual medicine just move forward and help so many people get rid of pain and enjoy a better sex life.
Yes, I
Yeah.
think pain is probably the biggest area across all our devices. Um, and often it starts with solving pain and then moving into experiencing pleasure, building up intimacy,
Mhm.
improving relationships. But often a lot of it comes from addressing pain first.
Yeah. Yeah. And it's so common to have pelvic pain, both men and women.
Yeah.
I see it constantly in my practice. And this is so great to have more options because really my option is sending them to pelvic floor physical therapy that they might get into a few months from now. And then you're going to take several months from then to feel better. So this is a great resource. I love that it's covered and that you can use your FSA or HSA account because that makes it more accessible, like you've said. And hopefully that even gets better as we get more coverage for them. This is amazing.
Yeah. Thank you.
Yeah, absolutely. Thank you so much for coming on and for talking us through all of this. I'm just so excited about these products. And in the show notes, I will include a link so you guys can go check out their store and see their products. And I'm just really hope that those of you that are dealing with these issues that you go and try these because I really do believe in them. I've met with other people in their company and I know Dr. Amy Perlman who speaks a lot for you guys. She is raves about these products and I'm just really excited to have this option out there for our listeners and my patients.
Thank you so much.
Yeah, absolutely. All right, everybody. I hope you got a lot out of that as like I did, and I will see you next time on Between the Sheets. Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics between the sheets.